So here you are watching adenoidectomy in a 2.5-year-old child, for which we have also performed intracapsular tonsillectomy. The child was having grade 4 adenoids. We had given betamethasone for 7 days prior to the surgery, and you see the adenoids have regressed a little. So this is the boundary. This is the Torus tubarius. This is the passavant's ridge, and that's the choana. So I'll first start by debulking the. I'm using a 70-degree scope and going from inside the oral cavity, because in the nose there is no place for me to put the scope. The child is so small, the nasal cavity is also so small. So I'm just debulking the adenoid layer by layer using plasma coblation, and that's the choanal adenoid on the left side. So as you can see, when I'm performing surgery from the oral cavity, there will be a little disturbance because of the saline dripping in front of the lens, and it's difficult to make out the buccopharyngeal fascia, so I have to be really careful, otherwise I can open up into the buccopharyngeal fascia. The setting for ablation is 9, and that for coagulation is 4. Now that's the choanal adenoid on the right side. That's the torus tuberis. So on the superior part of the torus tuberis, there are some choanal adenoids which I'll remove, and I'll first remove the total bulk and then finally go for the finer work. That's the torus tuberis. So I'll remain away from the eustachian tube and only take away the superior part. Now when I go into the depth here, superiorly I'll get the periosteum below the sphenoid sinus in this part, which is my superior boundary. I've still not got it. I'll keep on removing tissues till I see the periosteum, and that's the periosteum here. This is still the lymphoid tissue. This is the torus tuberis on the right side, and I'm removing the lymphoid tissues from the superior part of the torus tuberis. Now this is the passavant's ridge, and you can see a lot of adenoids over here. So obviously let me remove the bulk. I have not yet gone till the posterior boundary, which is the buccopharyngeal fascia. Now I'm going towards the posterior boundary, which is the buccopharyngeal fascia, which is a little more difficult to view in from this angle, it's much easier to view when you are going from the nasal cavity, because there you see it head on, here you are seeing it side on. So anyway, I'll remove all the tissues layer by layer. When you are on the sides, you have to be very careful because there are some small vessels which come from the lateral side. So you have to be careful about that. Now I have still not seen the buccopharyngeal fascia. I do not want to open up the buccopharyngeal fascia at any cost because that will give a lot of pain to the child. Sorry. I'm first removing the major bulk. That seems to be the fascia. And that's the Torus tubarius behind this. This is the Fossa of Rosenmuller. We'll not go deep into the Fossa of Rosenmuller. I'll first remove all this bulk behind the Torus tubarius on the right side of the patient. So now let's see what is pending. So there's a lot of tissue pending in the inferior aspect, near the passavant's ridge, and behind the Torus tubarius. So this is the advantage of this route, that you can remove tissues behind the Torus tubarius, which is not so easy when you do the surgery from the nasal side, because then the Torus tubarius does not let you see behind it. So this is the advantage, and the disadvantage is that you do not see the buccopharyngeal fascia so nicely from this view as you see from the nasal side. So after doing this, I'll still try to put a scope from the nasal side and see if I can negotiate and see the buccopharyngeal fascia in a better way, because I am sure that this part still there is some adenoid left, but I do not want to take chance of opening up the buccopharyngeal fascia. So this is almost 80-90% of the job is done. It's not still 100% according to me. So allow me to try changing the scope and going from the nasal side. So thank you for watching part 1.